Welcome back. February is American Heart Month, a crucial time to focus on cardiovascular health since heart disease is still the leading cause of death for men and women here in the U.S.
But how do you know if you're actually experiencing a heart attack, or when do you need to go to the hospital? Joining us now with some answers is cardiologist Dr. Sovari with Dignity Health, the St. John Hospital in Oxnard. Good to see you.
Thank you for having me.
This is such an important topic to talk about. We just talked about it's the leading killer of both men and women. Let's talk about the important signs of heart disease and some of the most common ones.
Sure. Heart is basically a muscle pump that sends the blood through the lung, get it oxygenated, and then sends the blood to rest of the organs in the body. And therefore, if this pump is weak, it's going to first felt as shortness of breath, making it one of the important signs of heart disease. If this heartbeat of this pump is going too slow, it cannot perfuse the brain, and it can be felt as dizziness or lightheadedness. If it's going rapid and irregular, it can give the feeling of palpitations or heart racing in the chest. Finally, this pump needs its own circulation and nutrition. If there is a blockage in the arteries of the heart, it can be felt as a chest pain or chest discomfort.
All right, if somebody's feeling these heart symptoms, what should they do right away?
Good question. The short answer is seeking medical attention. The detail comes in how and how fast do they need to go to the emergency room. I would say it depends on a few factors. First of all, the severity of the symptom. A minor shortness of breath versus a severe shortness of breath, cannot catch in the breath, needs to go to the emergency room. The second factor is progression of the symptoms. Even though they are not very severe, if they are continuously and relatively rapidly progressing, needs a more urgent attention. And finally, it depends on the patient baseline medical problems. If someone has a known heart disease, obviously has more urgent need to be seen.
All right, and so maybe that this doesn't happen and you don't have to go to the hospital. How can we prevent heart disease? What are some factors that we can do?
Good and important question. Obviously, diet, we have to monitor our diet. It's been repeatedly shown that Mediterranean diet, for example, reduces cardiovascular risk in diseases. Regular exercise and cardiovascular exercise, these two topics have been talked a lot of time. I would like to bring to the attention the importance of measuring the baseline factors related to the heart. So all of us, we have to know our weight, we have to know our height, we have to know our BMI, we have to know our baseline blood pressure and heart rate. These basic information gives us more basis into screening for heart disease.
What about the role of wearable monitors and devices in detecting heart disease early? Because you constantly see items you can buy online now.
Right. Yeah, that's definitely is an emerging, important emerging tool in diagnosis and monitoring cardiac and other medical problems. They have a very good, important role in diagnosing the heart disease. The main advantage of all of these devices is that they provide a continuous data for us, as opposed to traditional conventional tests, for example, at the doctor's office that only give them a snapshot of the heart disease. They give us a continuous data throughout the day. Also, it allows us to correlate those findings with some of the daily activities. What is the effect of our diet, our exercise, our rest and sleep in related to these heart diseases?
All right, and you're doing a lot of cutting-edge work. What are some of the new technologies that you're excited about?
Great. There have been a lot of tremendous new progress in cardiovascular treatments. A lot of them are very exciting upfront. One of the important things is a disease called atrial fibrillation that more than 6 million Americans have it. And this irregular heartbeat can make a blood clot in the heart that if it pumps to the brain, it can cause a stroke. We traditionally prevented that with anticoagulation or blood thinners with a lot of side effects. Imagine 6 million people taking blood thinner for the rest of their life. It comes with a lot of bleeding side effects. And nowadays, we have a minimally invasive procedure in that through an IV line from the leg, we can push and implant a tiny device in the heart that prevents blood clot formation and prevents a stroke and takes the patient off the blood thinner completely.
Wow, that's huge.
What's it called? Anything in particular?
The most common device used is called Watchman device. There have been other FDA-approved devices called, for example, Amulet, and doing the same thing, yes.
All right, Watchman?
Watchman.
Watchman, okay, great. Thank you so much for important information. We appreciate you.
Thank you for
All right, for more information, you can always log on to dignityhealth.org. Thanks for coming in, Doctor.
Yeah, thank you
so much.
All right.